Hi, Tanesha N Lawrence, wife, mom, caregiver, and a licensed health and life insurance producer. And you're tuning in to Tanesha N Lawrence Speaks podcast. And today's episode is insurance term of the day, and that is coinsurance. Coinsurance is something that you and the health insurance share the cost. So if you tuned in to last week's episode of Insurance Term of the Day, that was deductible. This will go hand in hand together. And what that means is once your deductible is met, then if your summary of benefits or benefits of coverage spells out coinsurance and it says 20, 30, 40, 50%, that is something that you will pay towards, will share with your health insurance company. So we're talking about in-network because it goes deep. So it could be a little confusing because if you have a plan that has in-network and out-of-network benefits, your coinsurance could be a little different. Well, a lot different. So if you go in-network, that saves you money because that in-network provider or doctor or hospital has shook hands with your health insurance company, filled out a contract and said, I will not balance bill your member. I will accept the cost that we agree on per service. And whatever that allowed contract rate, that is something that you and the insurance company will share the cost. Usually once the deductible is met. It depends on how your benefit plan spells out and what type of plan and insurance company you have, because there are different plans and there's a lot of plans, and I know it could be confusing to a lot of people, right? So that's why I have created protectioninplace.com. If you click on insurance, you will get a lot of information, basically education on health insurance, life insurance, dental, vision, different, things that we need, the essentials in life, for, even though you don't go to the dentist once a year for cleaning, you just never know when you might need to go to the dentist. You just never know when you need an eye exam, right? So that's off topic, but a lot of people need help and educated on what type of plan they have, right? Because when I was working in the healthcare health insurance company, I was in the care consultant department, and a lot of people will have problems on picking or choosing a plan, and they will ask me, well, after I explain it, they will ask me, well, which plan from plan A to plan B, which one should I choose? Which I wasn't licensed, so I could not tell them what plan to choose. Now I am a licensed agent, so I can suggest or recommend, but I like to educate you. I like to help you understand what type of plan it is and how it fits in your life, because a lot of people are different. Your aunt or your cousin may have this plan, but it doesn't fit you. So you want a plan that fits you, and you want a plan that fits your pockets, your money, where you're going to have to pay a month, because you don't want to look around and you miss premium payments. Now you don't have health insurance, or you can't afford the copays of the coinsurance or the deductible. So coinsurance is something that you share with the health insurance. So say, for example, you have a surgery done and it's outpatient, and you go to an ambulatory surgical center. Ambulatory surgical center is an independent surgery center, and it's not connected to the hospital. Now, even though hospitals may own an ambulatory surgical center, but it's not connected. And that's another episode where how they bill hospital when you go to an ambulatory surgical center versus an independent ambulatory surgical center. Because Your summary of benefits, if you look at your summary of benefits, or if you get someone specialized to go through your summary of benefits or your benefits of coverage, I suggest that you go through your benefits of coverage because it explains your full detailed plan. With the summary of benefits it's a summary, right? So it don't go in details on the exclusion and different things like that. So you want to look at your benefits of coverage package that the health insurance send you when you enroll into a plan. So you have a surgery done at the ambulatory surgical center and your coinsurance is 20%. So the total bill is $1,500. This is an in-network outpatient surgery center. And the allowed contract rate that this surgery center has shook hands with your health insurance company and said, we will accept with this particular procedure code. Say you had a colonoscopy done. With this colonoscopy, the allowed contract rate is $1,000. So with that $1,000, you will pay 20% of that, and your health insurance will pay 80%. Now, assuming you have met your deductible, and now you just have coinsurance left that you have to meet, and your coinsurance will go towards your out-of-pocket max. And it's very confusing, and I know, but I want to explain it as simple as possible because it's a specific definition of coinsurance, but I want to explain it to where you understand, right? That's why I was the best in my department because I explain it how I understand and I relay it to simple. I relay it simple, basic, no mumbo jumbo, no fancy words or terms or examples. I want to explain it very simple and basic so you understand, because this is your life you're playing with, your money you're playing with, and nothing is funny about not having health insurance or understanding what you bought because you feel like you waste money and portrayed or miscommunicated. So let's understand what you have or what you're trying to get. So coinsurance is something that you share the cost with your health insurance company. So that being said, like I stated, you have a colonoscopy done at the ambulatory surgical center. That is the outpatient center that is not connected to a hospital, meaning is another building. Some doctors may own their own ambulatory surgical center, and they may say go down the hall or the building next to it, and they perform their surgeries there versus in their office. So it's a surgery center where you can get a colonoscopy done or endoscopy done or any other surgery that could be performed outpatient in that surgery center. So it's something that is shared with the health insurance company. If the colonoscopy total bill is the colonoscopy bill is $1,500, that surgery center has sat down, filled out a contract, signed it, and said, I agree this colonoscopy procedure. And the procedure codes is many different procedure codes for a colonoscopy. But this particular one that you had done, yes, I will accept $1,000. They already have this ahead of time. So it's not that they're trying to get over on you. This is already set in stone. This is the contract rate that I will accept. They both agreed $1,000. This particular procedure code. Your coinsurance is 20%. You will pay 20% of the $1,000. The health insurance company will pay the 80%. Your coinsurance, anything that you pay will go towards the out-of-pocket max, not what the insurance company pay. Everything that you pay will go towards the out-of-pocket max if that's how your benefit reads. So that's why it's very important to understand what type of plan you have, what goes towards the out-of-pocket, what goes towards your deductible. And that's why I have created protectioninplace.com, where you can set up an appointment with the care consultant specialist so they can go over your plan and what type of plan you have. And it's so much easier to understand from a specialized advocate, because you could choose the wrong plan and now you paying your premiums and you can't use it because you can't afford the deductible, the out of pocket, or you didn't know that service cost that much. Because with that service at that particular facility, it's $5,000, which you could have went to the doctor's office. So it's a lot of ways that you can maximize your benefits. And you want to know, have knowledge on everything your benefit has. You can call the health insurance company. You can speak to your agent who enroll you to get more information, or you can go to protectioninplace.com and set up an appointment with a specialized care consultant. Now, if you have any questions about coinsurance, if you didn't understand something that I said, go to Protection in Place, click on insurance, and submit your questions. And then that allows me to understand what is needed in the marketplace, what type of questions, what kind of confusions are out there. And it keeps me knowledgeable on what you need from me to help you understand. So I'm here to serve you. Yes, I am a licensed health and life insurance producer, but I am more of an educator on what I know, what I have experienced and learned, because I am a caregiver of my mom and I do understand a patient perspective. So I also understand the insurance perspective process as well. So let's put two to two together and help you get in the know how insurance work and how you can use it to the maximum benefit, right? So I hope this was interesting to you, and I hope you learned a lot. Again, if you have any questions, please go to protectioninplace.com, click on insurance, and submit your questions. And this is Tanesha N Lawrence Speaks podcast, and I am a wife, mom, caregiver, and a licensed health and life insurance producer. And you have a wonderful day. Hi.